Workplace violence in healthcare is an important public health issue and a growing concern. According to the U.S. Bureau of Labor Statistics, the healthcare and social service industries experience the highest rates of injuries caused by workplace violence and are 5 times more likely to suffer a workplace violence injury than workers overall, a reality that brings healthcare and security leaders together to combat workplace violence. This podcast will describe how America's hospitals and health systems are committed to a culture of safety for every worker, patient, and family member who enters our facilities. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle, Executive Speechwriter with AHA. Our moderator for this podcast is Laura Castellanos, Associate Director of Clinical Affairs and Workforce at the American Hospital Association. Laura also heads AHA's Hospitals Against Violence initiative. Today's topic is the collaboration between AHA and the International Association for Healthcare Security and Safety. Our guests include Erik Martin, Chief Nurse Officer and Vice President of Patient Services at Norton Children's Hospital, and Connie Packard, Chief of Public Safety at Boston Medical Center.
I want to begin by thanking both of our speakers today. Erik Martin is part of AHA's Hospitals Against Violence Advisory Group and President-elect for the American Organization for Nursing Leadership. Thank you for your ongoing support and collaboration, Erik. And we have Connie Packard, who's also a Vice President and Treasurer for the International Association for Healthcare Security and Safety. And I am your moderator, Laura Castellanos, and I've had the absolute pleasure of working with both of our speakers today. Both of our groups were really brought together to collaborate and find ways on how to best support hospitals and health systems to combat violence in the workplace. And today we will discuss this partnership, the impact of violence on our workforce, and what resources and lessons are available for healthcare and safety leaders. So Erik, let's start with you. Can you share more about what brought these two organizations together to focus on improving physical and psychological safety for the healthcare workforce?
Sure, I'd be happy to. First, thanks for having me today. It's been a pleasure to serve on the Hospital Against Violence Advisory Group. I know early on we spent some time brainstorming and talking about different strategies and priorities that this group wanted to focus on. And it was really important for us to focus on the hospital environment and the healthcare environment and making sure that we implemented strategies or focused on strategies that could help address workplace violence. And part of that, we recognize that having collaborative relationships with other groups that are focused on the same thing will help us with accomplishing our goals. And so it was serendipitous, if you will, for us to partner with IAHSS on this work. So it was really nice to come together and brainstorm ideas and talk about our collective efforts to see what we could accomplish together.
Thank you. And Connie, anything you'd like to add about our work together?
Sure. I also want to thank you for having me today to speak on this very, very important issue of workplace violence, and particularly in healthcare facilities. I would agree it was all about collaboration. Realizing the importance to share best practices. I think that IAHSS has shared information with other associations, not just in the United States, but in Canada and all other countries, which is where our expertise comes from. So I think building a safer workplace information would be invaluable for security leaders, as well as CEOs or the C-suite. And a great opportunity for us to be able to share what has worked, maybe some things we need to work on, but clearly trying to mitigate the violence we're seeing in the workplace.
Great, thank you for sharing. So about that, we do know that violence in the workplace is a growing concern for both healthcare and safety leaders. And we know that COVID has exacerbated that issue. So I want to ask you both, what should leaders know about the impact of violence to the workforce? Connie, let me hand this over to you.
Sure. Yeah, I think leaders, from the top down, everybody should understand the effects of trauma, of being a victim. I think for those that we've seen, unfortunately, go through these tragedies, It's really difficult to come back to the workplace and feel like it's safe for our employees and patients. I also think having comprehensive plans, policies, training to mitigate these events is better to be proactive than reactive. I think that's what IAHSS has shared with many groups. I also think secondary crisis debriefing is huge with these events. We need to sit down and talk about, what went well, what could be better. And the more collaboration you have with clinical teams, human resources, when these type of debriefings are needed, like the saying goes, past behavior is usually a predictor of future behavior. And we need to be aware of that and establishing some type of communication for our employees.
Connie, let me just ask you a follow-up question. In your role as Chief of Public Safety at Boston Medical Center, what could you share with us in regards to the impact of COVID and the violence being seen in healthcare settings?
Sure. So, it's almost twofold. During COVID, like other healthcare facilities, there was limited access into the hospital. We had shut down some entrances, no visitors, just in certain circumstances. So we saw less and less of incidents happening. However, in the emergency room, that's where we saw the uptick in violence. I think it was, a variety of reasons. We have seen an uptick in mental health, substance use disorder, and it has just been much more prevalent now than before COVID.
Thank you for sharing that insight. And Erik, I want to ask you the same question. What should leaders know about the impact of violence to the workforce? And if you could also share how COVID has perhaps exacerbated that situation.
I think, most healthcare leaders know that individuals who go into the medical field or into the field of nursing do it because they are really committed to improving the health and well-being of the society. They dedicate their lives to serving the public. And so violence in the workplace really takes a toll on staff and providers, both their emotional and psychological well-being and their physical well-being. I think when you ask, how COVID has exacerbated it, I think Connie highlighted a lot of the challenges that we faced, but COVID has helped create an environment that is, both polarizing and at times politically charged. And things like opinions around mandating masks or vaccine requirements have, I think, increased those tensions a lot for staff to staff, staff to the public and our patients. And it's surfaced conversations and tensions that I don't think we've seen before. And Connie's comment on behavioral health, we've seen that spike, across the nation, but more specifically, as Chief Nursing Officer for a pediatric institution, we've seen that number skyrocket. And we've also seen increases in abuse and violence and eating disorders, behavioral health in general, and in our patient population has just soared. And those kind of situations always add another layer of complexity for our healthcare workers. And it makes it challenging for them to show up every day and be their best version of themselves.
Thank you both for sharing that insight. And that's the work that we hope to achieve here, is to support healthcare and security leaders in taking the right actions. And we have created a framework with the strategic pillars of culture of safety, risk mitigation, trauma support, and violence intervention. And we'll share more about that. And part of this podcast is to really help understand the resources that this collaboration has yielded.
Part of that is a guide for hospital, health system, and security leaders called Creating Safer Workplaces. This guide will help apply the framework and mitigate violence in healthcare settings.
We also have a compendium of case examples of what we're calling safety strategies that work, to give some of those concrete examples. So we hope that you can access those resources and put them into action. But I want to hear from two of the people that contributed to this work. Erik, I'll start with you. Can you share with us what lessons were learned as we were pulling these resources together, or what would you like to highlight for folks as a takeaway?
I think one of the things that was an aha moment for me was just the continual themes that we saw as we carried this conversation on, around leadership buy-in, leadership support, leaders leading by example for, things like zero tolerance policies, but also with reporting structures. It became very evident that leaders needed to outwardly say that reporting these incidences of violence was important and that they were going to use those reports to improve the work that they were doing. I think the other theme that rose was kind of in line with that was data. Organizations and leaders are starving to have accurate data that is consistent, that they can use to show improvement and to determine what interventions they want to put in place to make improvements within their organization. Another theme that kind of surfaced was just around regular risk assessments and mitigation of violence. And, some of the stories that came out around some of the best practices that hospitals are doing just in terms of assessing the risks and in some cases even being proactive and identifying where they think there might be an episode of violence in their hospital, putting measures in place to prevent those episodes from happening, and then having consistent, regular follow-up to make sure that their plan is being effective. So I think those are some of the themes that stood out in my mind as we move this work forward.
Connie, would love to hear your thoughts.
Sure, I would agree wholeheartedly with everything Erik just said. I think there was valuable lessons, the opportunity to discuss and share with senior leaders, past, present, future trends, the data and stats Erik mentioned is huge. I mean, we saw a little bit of sharing the assaults on clinical teams with a committee, a workplace safety and violence committee, goes a long way for them to understand that, verbal threats, physical threats, and what we try to do to mitigate that. One of the wonderful things that we've shared and a great lesson was to give people the ability to see in the medical record if this person had shown inappropriate behavior. So as you start to triage a patient, you already know that there's a potential where you may have to alert security sooner than later. That went miles and miles through this organization to show how we were trying to mitigate this risk and vulnerabilities. I also think one of the lessons learned was, to your point, Laura, of resources. IAHSS has a great tool with their guidelines, and it's probably once a month I open it up and share, particularly when you're going through construction and design. But it helps us when dealing with countermeasures and being prepared. I also think it's a great opportunity to join IAHSS. Being able to network with your colleagues is a tremendous resource that you just don't get on a document. So I would highly recommend that. Just shameless plug right there.
That's great, Connie. Thanks for sharing. Those resources can be accessed through that new guide.
But I also did want to take an opportunity, Connie. You mentioned the different resources. IAHSS also has a certification for safety professionals. Can you talk a little bit about that and how we can encourage our leaders to promote that amongst their security leaders?
Yes, we have Certification Healthcare Professional Administrator, known as CHPA, which I have. I think most security leaders, to promote themselves in the institution that you see, it should actually be required, because it shows that you have the expertise to make these security decisions. And so we encourage it at IAHSS to get this certification. It's easy. There's people out there that will help you before you take the test. We started a new program to motivate and mentor future CHPAs. But I think that in most cases, that's a criteria that I think Human Resources looks for. That's how well we've been able to share that information.
Thank you so much. And I'm just going to have one wrap-up question for you, Erik. I know that part of our intention in bringing these two groups together is to help elevate the voice of security leaders. Can you share with us, the importance of having that collaborative, multidisciplinary approach to violence prevention in the workplace?
Yes, absolutely. I think one of the things that we learned through our conversation was just the importance of those two working together. And what we didn't probably talk about was the training and education that the frontline staff are getting to be better skilled and better prepared to address the issues of violence. And it starts with early recognition of when a situation might be starting to escalate and knowing who to tap into and who to call to help address those issues. And then when it does escalate, knowing how to intervene. And I think to your point around collaboration, what we've learned is some of the best practicing hospitals have security alongside with the frontline healthcare workers, learning side by side how to work together, what each other's strengths are, and how they can leverage each other to make sure that they're being as safe as possible for themselves and for the patient that's involved. And then when those events do happen, debriefing afterwards together as a team and seeing what went well, what the opportunities for improvement were, and what they can do differently next time. So I think our two teams coming together to collaborate through this just brought to surface so many best practices and things that we can all use moving forward.
I want to thank you both so much for taking this time to talk to us. I know that this work will continue, and I think that some of what you shared that came to surface and some of the best practices will help us advance safety for our workforce, our patients, and our community. Thank you both.
Thank you. My pleasure.
Thank you for having us.